So assessing client's medical history, checking for allergies. It says here on the MAR that there's no known drug allergies, which means we can administer any medication. It says in the prescription to administer cloxacillin at 10 a.m. 500 milligrams intramuscular every 12 hours via vastus lateralis. So I'm gonna perform hand hygiene, and then for the second time I'm gonna check the MAR again. Cloxacillin 10 a.m. 500 milligrams intramuscular every 12 hours. So I'm gonna check the vial now. For the expiration date, it says here November 2025. Okay, then it's good. I could still use it. So it says here, because it says in the MAR we need 500 milligrams, so we need to add 1.7 mils of the diluent, which is the sterile water, and then that means for 1 mil there's 250 milligrams, so we're gonna get 2 mils from the reconstituted solution later on. So that's the calculation. Okay, so now I'm gonna prepare what we need. So we have the sterile water, and then we have this one. Both of their expiration date is not this year, so we're good to go. And since we don't need a lot, I'm gonna use the 3 ml syringe and a blunt needle for now, and of course our alcohol swabs. So I'm gonna open this one. I'm banana peeling the syringe, and I'm gonna banana peel the blunt needle. So I've prepared it. It's clean, and then we're gonna flip this. Since it's new, we don't need to wipe it with the alcohol swab. So since we're taking 1.7, I'm getting air, oops, 1.7. So we have 1.7 of air, and we're gonna inject. Okay, so we're injecting the air inside. Wait. So now we're taking a diluent of 1.7 mil. And then now we're gonna take 1.7 mil Okay, I got 1.7. There's no more water. I still need 0.2 mils. Okay, there. I have 1.7 mils. So, using the scoop method, we're gonna scoop the needle in again. Where are you? There, okay? So, now we're gonna put the diluent inside this one. So I'm gonna flip it. And I'm gonna take this out again. And then I'm gonna inject the diluent inside. Then using the scoop method again. close this one. And using the palm of our hand, we're gonna roll it. There. So now that we've prepared our vial, we're now at the bedside. Okay, Mr. PNL, my name is Dawn. I'm your nurse for today. I'm gonna administer cloxacillin into your vastus lateralis because it says in your MAR that we need to administer it at 10 a.m. So we're gonna do it now, okay? I hope that's okay with you. Yes, it's okay. To identify yourself, can I just verify your name, Mr. PNL, and your date of birth? It says here the date of birth is January 1st, 1944. Okay, thank you, Mr. PNL. So for the last time, the third time, we're gonna check our MAR again. So it says here, cloxacillin 500 milligrams intramuscular every 12 hours. Great. So providing privacy, closing the curtains, and performing hand hygiene, and then wearing our gloves. So now we're helping our client to a comfortable position, only exposing the parts that need to be exposed, which I believe would be the legs or the thigh. So this is the thigh, and we're inspecting it for any tenderness, bruising, lesions, or lumps, and I don't see any. So now, in order for us to know where we need to inject the medication, we're gonna do this, okay? And then in between my hands, this is where we're gonna do the injection site. So we're gonna clean it with an alcohol swab. So now we're ready for injection. What we're gonna do, we're gonna do the Z tracking. So we're gonna stretch this skin like this. Okay, once we stretched it, oh, okay, I need to draw the solution first in our syringe. Okay, so I'm gonna use a different kind of needle. This is the same needle, but for you know, when it's like the actual setting, we have to use a different kind of needle. So I'm gonna draw the solution. I'm gonna put 2 mils of air since we need 2 mils of air. And then I'm gonna inject air here. Okay, now that we've gotten that, we will take 2 mils of the medication. Okay. So I lost all my, I finished it all, and I still don't have 2 mils here. So let's just pretend that I took out 2 mils from our medication. So we're gonna do the Z tracking now. So you're gonna stretch the skin over like this, and then in a dart-like motion, you're gonna inject it to the site. So now that I've injected that, I'm gonna inject the medication in for 5 to 10 seconds. So I'm gonna scoop this in again, and then I'm gonna put a swab over it, put a gentle pressure, and then it's done. So now that the injection site is done, we've injected the medication. We're gonna cover the client with a blanket, ask them if they need anything, and then after that, we will throw the syringe and the needle to the sharps container, and we're gonna remove our gloves and then perform hand hygiene. So now we're gonna uncover our patient to see if there is side effects or adverse effects that's happening on the site. Ask if there is any pain, if there's bleeding, and then ask the patient that if there's any pain, sensation, numbness or tingling sensation at the injection site. Ask them to let you know if there are stuff like this that happens. And now we're gonna document in our MAR. So it says here, cloxacillin 500 milligrams, which we did, intramuscular every 12 hours. So what we're gonna do, what's not written here, is we're gonna document where we injected the medication. So we're gonna put vastus lateralis, and then it says here the time, so we're just gonna put our initial there, I think, and then we're done.